Hello, my name is Andrea Hall, and this is my fact sheet presentation for APN 620. Syria, an ancient culture and cuisine. Today we will learn traditional foods and dishes of Syria, traditional health beliefs of Syrians, traditional eating patterns of Syrians, current food practices in Syria and of Syrians in the United States. Traditional foods and dishes. 87% of Syrians are Muslim and follow the halal tradition for preparing food. The halal tradition is a technique and method of slaughtering their animals. Pork is avoided. Observant Muslims do not drink alcohol or food prepared with alcohol. Some of the traditional food dishes. Kibbeh is the national dish, and it's made from minced lamb or beef. It has onions and spices. It's often served raw, baked, or fried. Lamb is the preferred meat, but they do eat chicken and beef. But you will find most of the traditional dishes are lamb. Fruit and vegetables are included in a typical diet. Some of their favorite fruits and vegetables are dates, figs, apricots, peaches, eggplants, tomatoes, and cucumbers. They use a lot of dates and figs in their preparations for their desserts and just for snacking as well. Some more common food dishes in Syria. Shawarma, that's lamb roasted on a skewer. To the right of this table, you will see a picture of shawarma. It's actually lamb that is layered, and in between the layers, there is often onions and tomatoes and other things. And when it's served, it's just cut right off of the kebab or the skewer and served with the pita bread, which is a common dish, and you see a picture there on the right of that also. They do eat a lot of pickled vegetables. If you get a typical dish from Syria, you might see some bright fuchsia looking vegetables, and those are pickled radishes, and those are often just eaten with many meals, and they eat pickles, small pickles, quite often as well. Hummus is another dish that is one of their traditional dishes. That is a chickpea dip that is mixed with tahini and olive oil and typically kind of whipped into a smooth dip and eaten with the same pita bread or with vegetables. Another dip that they use or a spread is called baba ganoush, and that is eggplant that is roasted and whipped up with olive oil and spices, and also pita bread would be something that you would use to eat that. Mashish are these are different kinds of stuffed vegetables. It could be stuffed grape leaves, which might have rice and ground up lamb and spices, or it could just be a vegetarian one with just rice and spices. Zucchini and bell peppers are often stuffed with rice and herbs and different meats also. So that mashish is just the name of a stuffed vegetable. Tabbouleh is a salad that you will see often on a Syrian table, and it's made of cracked wheat, parsley, and tomatoes. Baklava, which is a dessert, is a phyllo pastry that's filled with chopped nuts, and then it's soaked in honey. And that the phyllo pastry is many layers upon layers that are each layer is soaked, and it's a very time-consuming dessert to make. Some of the typical beverages that you might see. Well, they drink coffee and tea throughout the day. That is something that they just consume as a drink every day. You might see ayran, which is a cold salted yogurt drink. Halib, which is a fruit syrup made from carob dates, grape molasses, and rose water. It's very sweet. Definitely, it is on the sweet side. Uh, Another drink that you hear about, it's either called bolo or polo, depending on where you are, is a type of Syrian mint lemonade. Some of the traditional health beliefs. The aloe plant is hung on doors to bring long life and health to the household. Herbal therapy is widely used. Grilled onions are used to heal the flu. They believe that olive oil can help prevent anemia, and they use olive oil in most of their dishes. Cupping therapy is used for a wide variety of ailments, and if you've never seen this, it's very interesting. And a lot of cultures actually use this to draw out the illness within the person. But it is a fascinating therapy that they use. Over at the side, there is a chart that lists some healing herbs and spices that they use typically for different things, and a lot of cultures use these as well. But they definitely use some of their own herbal therapy remedies to treat different illnesses and conditions. Some of the common health beliefs, they do value Western medicine, but their preferences will reflect their own cultural beliefs. They do defer to what the doctor prescribes, but like I said, their preferences are going to reflect their cultural beliefs. They prefer to be seen by same-sex healthcare providers. If they are in the hospital for any length of time, they prefer a hospital gown that is long and doesn't expose amounts of their skin. They can be embarrassed by personal questions, so it might be difficult for them to be a little forthcoming with information about what is the illness or health concern at the time. Their family and friends, that support from them is very important to the Syrians, and they rely on their family and friends with as far as health care concerns too. Often they do stop their health regime after symptoms disappear. If they go to the doctor for a concern and they begin taking medication or starting whatever therapy it is that is recommended, if they see the symptoms disappear, then they'll stop the medication because they feel like they are better and do not need to continue it. So that is something that the healthcare provider needs to emphasize, that it is very important, even if they don't see those symptoms or no longer see those symptoms, that they continue to finish out the treatment that has been prescribed. Traditional eating patterns. The family meal is very important. 3 meals per day are typically served. Foods are eaten with the left hand, and a spoon is the most frequently used utensil. For breakfast, the typical meal might be pita bread, cheese, eggs, hummus, or yogurt. Lunch is their main meal of the day, and that's usually quite a bit later than we think of in the United States as lunchtime, usually from 2 to 3 p.m. That's going to be the big meal, possibly a cooked stew of meat and vegetables. Rice is typically served, pita bread, and some type of salad, which could be a lettuce salad, or it could just be tomatoes, cucumbers, and all kinds of mixed vegetables like that. But that is typically their big meal. For dinner, it's usually a late dinner, and it's light, similar to breakfast. And but it is a very important meal. They eat with their family, and guests are always welcome. If they invite you for dinner, um, it is customary that the guest does not bring food uh, because the host feels like um, that you're saying that they cannot take care of their guests. So it is customary not to bring a dish if you are invited to dinner. And it is also customary that when the host offers you seconds, that um, they don't expect you to refuse those seconds. However, if you've politely refused a couple of times, then they will accept that. But they do like to feed their guests. Syrian Americans typically just continue their traditional food practices from their native country. They do sometimes have problems obtaining certain ingredients for traditional dishes, or it's more expensive because they're imported. But there is increasingly more access to native ingredients due to a lot of Mediterranean markets popping up in the urban areas, and those allow for um, the Syrians to actually get food and products that are native, are customary in their countries or wherever they lived, and but they are becoming more frequent, and so the Syrian Americans have more access to those ingredients. Some of the health concerns that Syrians um, might incur are, um, as a whole, they demonstrate higher than average rates of anemia as well as lactose intolerance. Um, Syria is ranked 18th in the world for death from coronary heart disease, and it's not. They often have less access to, or in Syria, in the country of Syria, during war times, it's more difficult for them to get fresh meats and produce and things like that, and that's partly what's attributed to the anemia. Um, they don't drink a lot of milk. Um, they typically use yogurt-based drinks, which would be a different form than just milk. Um, Syrian Americans typically rely on their family when dealing with psychological issues as opposed to seeking help outside. They feel like it is something that should stay within the family and that the family will help take care of. From a professional perspective, some of the concerns of nutrition concerns that might occur would be that even though Syrians typically eat a variety of fruits, vegetables, and meats, they do have that high rate of coronary disease. They do use ghee, which is clarified butter, to cook and fry foods, and they do fry quite a bit of their food. So this could be an area as a health professional that might need work on, as if you have a client that is Syrian American. Anemia is another medical concern, as I mentioned, that could improve with small changes to their diet, adding spinach to some of their traditional salads, and also just making sure that they get that fresh meat and vegetables. less sugary drinks and desserts should be encouraged. This is, like I mentioned, with the drink that is just uh, basically a sugar syrup with fruit added to it. And then the typical desserts like the baklava and some of the other desserts are very high in sugar. And also, they do eat quite a bit of um, carbohydrates in the form of their pita bread. And this could lead to some issues also. Diabetes is not a health concern right now, but I see that this could be an issue due to those sugary drinks and desserts and the amount of carbohydrates eaten. I think also that addressing the level of physical activity would be a topic to bring up with the clients, just making sure that they're aware that that is important also to help with their diet. Some of the cultural components. The healthcare provider needs to be aware of the fact that that Syrians do not eat pork and that their meats have to be prepared halal style. So if they are in the hospital for any type of treatment or anything, those considerations need to be given. They should also be aware that in some of the major holidays that the Muslims follow, there are different nutritional guidelines that may need to be put in place. Um, for instance, they may have a period of fasting that interferes with whatever program that the nutritionist has come up with. Um, and family support is very important. And like I said, they are embarrassed by those personal questions. So those need to be approached very carefully and respectfully. Some traditional health practices that I mentioned that they still use could be the cupping therapy, which is used in the United States as well as in their country. They still use that. And here are the references that I've used for my presentation. Thank you so much for listening, and I hope you enjoyed the presentation.